hospital's report on the number of COVID positive patients in the hospital, our cumulative number is just over 1,600. And we're averaging on any given day, there's about 165 people in hospitals in Mobile County who are COVID positive. So that number is trending down somewhat, and we're very glad to see that the number of people hospitalized with COVID seems to be going down as well. So again, we have a spike in illnesses. Then later, anywhere from 5 to 15 days later, we see increases in hospitalizations. Those are also starting to come down. So now we're seeing the lag in people who have died with COVID. So it will probably take a few more days before we think that we have sort of gotten over past this big surge of cases that we saw in July. We also published our weekly expanded report today. It's available on our website. And again, this just goes into more detail about the outbreak in Mobile County. We're starting to see, again, we've talked about this before, but with the amended Safer at Home order extended through the end of August, and some schools deciding to reopen, we are seeing increases in the number of cases in those younger age groups. Early in our outbreak, it was mostly the 25 to 55, it was mostly elderly people, right? Folks over 65, because we were prioritizing testing for those more vulnerable populations. Then as more testing became available, we started seeing the growth in that sort of 20 to 35, 40 age group. So the younger people who are less ill or mildly ill or asymptomatic. So again, sort of that 20 to 50 age group. And now with schools starting back and sports starting back, youth sports, we're starting to see increases in the number of cases in those younger age categories. I guess colleges going back. So that is something that we definitely continue to we'll expect to see that trend continue, that we'll see cases rising in those younger age group. So we're still seeing that our cases are mostly female, and that we have about 34% that are African American, 22% white, and we still have a very large number with unknown race, and that we hope that to see some improvement in that, as one of our local laboratories is working hard with their clients to try to get race populated more frequently in their records. So again, you can see here this green line. This is the 25 to 49 age category. Been a slight incline over the past, the week ending last Saturday. When we look at the moving average number of cases reported to us, it still is rather high, because again, we've had a couple of days where we saw large spikes due to some lab processing that happened. So we're still, on average, on 7 and 14 day average, looking at, around 150 cases a day, but that's going to dramatically drop if we don't see any additional spikes and continue to see the low case count. So take a look at this information. Let us know if you have questions about any of it. I'll mention about hospitalizations. We have had some hospitalizations in the 0 to 4 and 5 to 17 age group, but just a few. So it seems that when children do get COVID-19, that the majority of them are able to recover from that illness without complication or without requiring hospitalization. And we still have seen no deaths in the 0 to 17 age groups. One death in the 18 to 24 age group, and again, someone who had extreme underlying health conditions. One of the things that we continue to look at to help use as an indicator of COVID in our community is the percent of laboratory tests that are positive. That has also been trending down. So we're down below 15%, which is a really good sign. It was at 12% from the data that we have from last week. The sort of interesting thing is that the volume of PCR tests has gone down dramatically. So back in July, we were averaging about 5,500 laboratory tests performed every day, and the data in for last week, and again, this is just preliminary, it's showing around 1,700. So an enormous decrease in the number of laboratory tests that are being reported to the health department. We think there are probably a couple of reasons for this. One is there have been dramatic change in the recommendations for testing. So we're not recommending testing for returning to work or school. We're not recommending testing for asymptomatic contacts. So that is definitely driving the reduction in testing. And then we also think that as more and more rapid point of care tests are available and are purchased, that we will see those rapid tests being preferred rather than the PCR test, which usually takes at least a day. So we think that that is also driving the number of tests down that we're receiving. So we've got a lot of work to do with making sure that everyone around the county that's using a point of care tests, that they provide those positive and negative test results to the state health department. So if you have a point of care test, so the ID Abbott Now, the Sophia, or the BD antigen test, and you're not sure if you are reporting properly, then contact us at covid19@mchd.org, and we will put you in touch with the Alabama Department of Public Health to get that reporting going. It's really important that you report both positive and negative test results to the state health department. It's also required by law. So we definitely want to help facilitate everyone abiding by the emergency health rules. You will see the map. Again, we're just updating this for the past 2 weeks. So we are seeing our cases trend right now. So take a look at that so you can see what's going on in your neighborhood or in the area where you work. All right. Here are some questions. Someone from the media was asking about the ADPH risk indicator and that Mobile is in the low risk category, and yes, that's true. So the ADPH updates their risk indicator on Friday, and we are in the green category, so that's low risk, and that's based on several pieces of information. I think I printed it so that I wouldn't get it wrong. Let's see. So it's based on the number of new cases. So if the number of new cases are declining over 7 days or over 14 days, then that moves us into lower risk, and yes, they have been declining. Also, the percent positive, so the percent of laboratory results that are positive is declining, and we're conducting as many tests as we should be for our population size. So the answer to that is also yes, the percent positive is declining, and we still are meeting our goal for the number of tests performed, but we're getting close to the bottom of that goal. And then the other thing are visits for COVID-like symptoms to our emergency departments. So we collect, the state collects data on every emergency department visit at Mobile area, at Mobile County hospitals, and the visits for COVID-like illness to emergency departments is also going down. So those are the three or four things that the ADPH uses to categorize that risk, and I believe that guidance comes out of the White House for the gating indicators if you want to put some research into that. See, and then there was some concern about, does Mobile being in the low risk category sort of make it more difficult for us to push public health messages or to try to keep people doing what they need to do to continue to slow the spread of COVID. And yes, it does make me worry a little bit. We don't want you to become complacent. The reduction in numbers and that we're seeing, the decline in cases, the decline in emergency department visits for COVID, the decline in the percent positive, all those things are attributable to our efforts to try to slow community spread. So we need you to continue wearing your mask, staying a 6-foot distance from anyone around you who doesn't live in your household, staying at home if you're sick, washing your hands, disinfecting high-touch surfaces, those sorts of things, so that we can continue to control the spread, to try to slow the spread of transmission in our community, because we know as schools continue to open up, college campuses returning, youth sports, football, some places still deciding to have football, movie theaters reopening, concerts being held, outdoor events. All of these things will contribute to community spread if we don't keep implementing those measures of maintaining 6-foot distance and wearing your mask and washing your hands constantly. All right. There were some questions about the effort for University of Alabama, well, the entire University of Alabama system to return to campus, and a lot of other schools as well, and that they are doing swabs self-collection at home. So I just want to read, you can go here too and read. The program is called Guide Safe. So again, it's mandatory entry testing for all higher education students entering campuses through the Alabama University system, and this laboratory testing is in conjunction with a couple of apps that were developed by UAB to promote safer entry methods using testings, tools, and actions. By testing and self-reporting through the Guide Safe app and conducting ongoing symptom monitoring, you can make informed decisions and help stop the spread. So the app is available for download starting today by anyone, not just students who are going back to campuses. You can get it on the App Store and on Google Play, and again, it's called Guide Safe. If you want to voluntarily sign up for one of some of these apps that help do some proximity identification when you may have been in contact, and also for the students, if they have symptoms, they can just respond to their app to let the schools know that they have symptoms and then receive information about quarantining appropriately. And the question from, I think this was from the media, about that self-collection, were there any concerns about those samples collected not being as accurate as if they were conducted by a medical professional? And I don't think there is. Every test has some limitations, but the tests that many of the drive-through clinics have been doing individual swabbing themselves for a long time. So I think that I've seen the instructions on this, and they're pretty good. Let's see, asking about summer tourism ending, fall festivals canceled. What kind of encouragement do we have for people in the months ahead? So again, there are safe ways to move about the community and to frequent retail establishments and to dine and to visit locations. So as long as you're adhering to the recommendations in the Safer at Home order, there's really no reason not to carry on with somewhat normal shopping and retail and visitation and tourism, those sorts of things. Just again, you have to do it following those measures of wearing your face covering, staying 6 feet away, and frequently washing your hands, and staying at home if you're sick. All right, someone on Facebook asked, they had a negative test. They had 3 negative tests for COVID, but tested positive on the antibody test. And yes, this can happen because the antibody test is not specific to coronavirus, to the novel coronavirus. So it may detect like exposure to other coronaviruses that circulate. Every year there are about 4 coronaviruses that circulate in flu season that cause, the common cold. So it's probable that you have been exposed to one of those in the past, and your positive antibody test may have been because of that. It's also possible that you were exposed to COVID and didn't even know it months ago. And so you no longer have virus, in your respiratory symptoms, so it's testing negative by PCR, but you had previous exposure to COVID. So there are a couple of reasons why, you might test antibody positive, but not have an active infection with SARS-CoV-2, which is one of the reasons that we don't use that test to diagnose active infection. All right. And from one of our news outlets, we got a long list of questions about high school football game that had been canceled because one of the teams had a player that tested positive. And there are a lot of questions here about this, and I'll just address a few. First of all, MCHD is assisting schools and youth sports and athletic directors and superintendents in interpreting CDC guidance and guidance out from ADPH and out of Commissioner Mackey's office. We're assisting in the interpretation of that guidance. We don't close schools down. We don't cancel football games. What we do is investigate cases of COVID, identify the close contacts, and then provide instruction about isolation and quarantine. So yes, if you test positive, you have to go home for 10 days. If you are identified as a close contact, you have to go home for 14 days. Did I say 10? COVID positive, 10 days. Exposed by close contact, go home for 14 days. So that is the direction that we continue to give to schools and to cases and to contacts of cases. And that will continue as it has since March, whether or not the case is identified in a high school or in a daycare, or in a business, or in a nursing home, or in a hospital. So we interview the case, tell them to isolate for 10 days, we ask them who they've been around, we contact those people to the greatest extent possible and tell them they need to stay home for 14 days. The other things you're asking about here, about the procedures, like what is going to take place should a football game take place, is really not my recommendation to give. There have, however, been some recommendations for school activities related to football games during the COVID-19 pandemic put out by the American Academy of Pediatrics. So some pediatric physicians, this is the Alabama chapter, sorry, this is brand new, that got together and provided some guidance, and we will be, helping schools interpret this guidance about what to do with spectators, what to do with concessions, some recommendations for bands and cheerleaders, and for activities outside of the home school. So again, these are recommendations from the Alabama chapter of the American Academy of Pediatrics. So look those up, and we'll link them on our Facebook website. So we will be taking this guidance and the guidance from CDC and guidance from Alabama Department of Public Health and assisting schools in interpreting that guidance. It's incredibly challenging for me to think about holding a Friday Night Lights game and being able to maintain all of those public health measures about social distancing and wearing a mask. And so anytime someone asks me, should movie theaters reopen? Should we have this concert? Should we have school? Should we do this? It all boils down to, can you do the things you need to do to limit spread of COVID at your event? And if you can, and you can reopen safely, or you can hold a game safely, then do it. But more often what we hear is that people thought they were doing everything they could, and they reopened, or they had an event and it didn't go as well as they had planned, and they end up having COVID cases. So if you want to talk about it, give us a call or send us an email at covid19@mchd.gov. We will think through these things with you, help you make some decisions about if it, as to whether or not it is safe to have a football game, or to open schools, or to have your concert, or to go to a movie theater. So these are all sort of new frontiers for us in the world of COVID, and we certainly want to continue protecting our most vulnerable community members to the greatest extent possible. So I will probably not be going to do a Friday night football game, because I have an elderly grandmother that I would like to protect from getting COVID, and I get a little nervous. I'm not gonna lie, when I'm out in public and people are not adhering to 6 feet distancing and they're not wearing their masks properly. So having said that, then let me just remind you about the proper wearing of a mask. I see this all day, every day, being done incorrectly. So again, if it has a metal strip here, you want to be sure to cinch it over your nose and then pull it under your chin. remove it by the ear strings, but it needs to be over your nose and under your chin in order to be worn properly. So with that, I will end today, and we will have our next COVID-19 update this Friday at 2:30. Thank you all, and be safe out there.
Dates, but what we're going to have is 16 testing teams that will rotate in the various health department facilities throughout Mississippi. So once we get those 16 teams online, then individual teachers will be able to drive through a mobile testing site set up at the health department to make that a reality. So Drew, I don't know if you want to talk a little bit about any specifics or not, but on the telehealth side.
Yeah, sure. With the children, one of the things from the safety perspective is it makes access virtual. It allows the healthcare providers to provide services virtually a lot easier than it did before. And if your question is COVID related, well, the schools are going to have their own COVID policies, but the chronic care needs of children haven't stopped during the pandemic. And I think with the telehealth policy, with mental health services in particular, it is going to have a big benefit on allowing the students who have those chronic needs to stay in the classroom, and it doesn't put that additional burden on the parent.
And I will just say the mental health side, when we talk about the public health risk of kids not being in school, the mental health side is one, and we've highlighted that multiple times with various people that have come to these press conferences. It's one that is really concerning to me, and I know concerning to everyone else across this state. It's been a real challenge. And so, as I mentioned last week, the fact is that when you look at child abuse claims, you look at child abuse reports, you look at sexual abuse reports, they're down, way down in this country. And in large part, they're down because many of our kids are not in school, because that's where a lot of our kids report those things, because their teachers are who they trust or their administrators are who they trust. And so we've got to work through all of those issues, but this is just one tool to be able to do that. Did I miss anything on the testing side? Okay. Good. Yes, sir.
Thank you. Dr. Dobbs, two questions. One real quick. How many students, again, are in quarantine? And when it comes to the testing, how long is it going to take for these teachers to get a result? And if once they do get tested, even if they're not showing symptoms, does that mean they go home for the day, or can they still keep working until the test results come back?
No, thank you. The number of students on quarantine currently are 2,035. And then as far as like the testing goes, it'll be going through the state public health lab. We have every anticipation that it'll be within that 24 to 48 hour turnaround period we have now. Obviously, if we have overwhelming demand, we might have to make some adjustments and recruit some other testing capacity. We do have some backups lined up already. But as far as requiring to be quarantined, if you're just getting tested just to get tested, you don't have to quarantine. But if you are symptomatic, then you do need to quarantine, or you need to isolate. I'm sorry, until you get your result back. Or if you're an exposed person to a case, you should be on quarantine anyway, and then so you would obviously be quarantined. So if you're asymptomatic and just getting tested because you want to get tested, then you would not have to quarantine. We recognize that teachers and school staff are true heroes right now, trying to educate our kids in